now.
Just turn it around.
Hey!
Yay!
Here we are.
Oh,
Holiday season.
Cheers.
I hope it's strong enough.
Hopefully it will be. Hello, everybody. You got Ashleigh and I just got our freshly made drinks,
Woo-hoo.
and we can't wait. Hello, hello. I see a bunch of people on here. How you guys doing?
I'm gonna log on.
It's just Ashleigh and I.
And so we can tag our skincare.
Oh, okay. So it's going to be Ashleigh and I today. Our
Yep.
guest is sick.
Yes. Under the weather.
Mm-hmm.
Whether you're sick and you're...
And I'm not going to bitch, but we got no advance notice until today. So, but you know, such is life.
Right,
We're gonna
such
make
is
it.
life. We roll with the punches.
We will roll with the punches.
We're good at that at Ideal Face and
That's
Body.
right.
You just gotta roll with it, you know?
So let's do some clean, like bookkeeping
Yes,
or whatever
yes.
while we're here.
There we
So
are.
we wanted to go through a few things before we get started here. And to let you guys know about some exciting announcements.
Yes.
We have renamed our live sesh.
Yes.
From Behind the Beauty to YovinoMD TV. So if you notice that, it will be a change.
Yes.
And that will be nice and exciting.
I wonder why it's coming in like that.
I don't know. It looks weird. It's like
Yeah.
all double.
Yeah. Interesting.
It's like, oh, you know what?
What?
I think it's because it's probably just on my phone because I set the font to huge.
Oh, that's probably it. That is probably it.
But
That's
does
so
everyone else
funny.
see that too? They
No,
can't.
it's just...
Oh, regular.
It's just, yeah. Wow, interesting.
Okay, I'm blind.
Okay.
I'm getting blind. Thanks, Ashleigh, for letting everybody
Sorry.
know that. Another thing is that we did is we have changed our labels. So this was the
Super
old
excited.
label, which is our Ideal Face and Body label. Do you see that? There's like a face, and then the white part is a body in the center. And we changed it to this beautiful YMD for YovinoMD. So we feel like it's cleaner and more sleek.
We should talk about this more. Like what we were wanting, right? In a label. Because we really wanted it to represent what's inside, right? And it's such a reflection of our products. It's so clean. It's sophisticated. It gets the job done. You know what I mean?
You want to scooch a little closer because I feel like you're all cut off.
Oh, yeah.
So yeah, you're right. Sophisticated and clean.
Yes.
But
It's
also-
for sure our product, you know? I love it.
So that was our toner. So we changed the label, so that's new. And now YovinoMD TV.
We wanted to do YovinoMD TV because the YovinoMD brand just keeps growing, right? So underneath, YovinoMD, we obviously have both physicians. We have YovinoMD skincare. Within our practice, there's so many different aspects of beauty. It's not just one thing. It's not super linear. You know what I mean? So we wanted YovinoMD TV to reflect that. Behind the Beauty was great, right?
But everyone has a Behind the Beauty.
Right. And that's a very popular name. But also too, within YovinoMD, there's lots of aspects to the practice. So we want to talk about different aspects of wellness. We want to talk about, health and fitness. We want to do all of these things. So that's why we kind of opened it up a bit.
Exactly. And the third thing we want to talk about is the new filler. If some of you have missed out on some of our lives, you can definitely check out my Instagram, and they're located there. But there's a new filler by Revenance, and it is called RHA, which is resilient hyaluronic acid, or resilient, something like that. And it lasts longer, lasts up to 15 months. So I know there are a lot of patients who complain and feel like their filler doesn't last very long,
Right.
gets chewed up quickly. So that is really good because now we have an alternative that can last a long time.
Yeah. So I have this filler. I have it in a few different places in my face.
Can you guys guess where?
Yeah.
If Ashleigh's ever-changing face has left you going, she looks a little different.
It's so funny. So there's this this guy that I'm friends with, and he has beautiful lips. Okay, he's a very beautiful man in general, but his lips are so big and juicy and just, I love them. So he DM'd me and he was like, when did your lips get bigger than mine? And I was like, well, I can give you the exact date if you're into details like that. But I was like, yeah, it's this new filler. And he said he loves it, loves the way it looks, you know, so.
Thanks, I'll just pat myself on the back.
I will too. So, if that is a frustration of yours, the filler not lasting as long, right?
And what was your main concern with your lips? Like, I know what it is, but why don't you tell them? What didn't you like about your lips before?
I didn't like, oh my God, there was a few things. One, they would always shrink so quickly. That was kind of like a thing that I always noticed. What do you mean
they always shrink quickly? Like after you got filler, it didn't last?
Yes.
What do you mean?
I always loved the way that my lips look like the day after Dr. Sarah injected them, because they would be swollen, puffy, and then I would always be super sad when that would go away.
But you were getting lip filler before me,
right,
too.
Right, but it was the same thing.
Yeah.
I'm just using that for reference because you're pretty much the only one who's ever going to do my lips from now on. So, so that was something. But it wasn't until I joined the practice that I even realized the importance of good border work, right? And what that looked like and how much I really loved it. I hadn't really experienced that until I came to Ideal Face and Body and Dr. Sarah. And her technique was just such that I loved the way that she did my lips and the border, but also too, I don't know, I mean, there's just so much that I like, and there was so much that I didn't like before. But I would definitely say the border was one, and then the size, I wasn't able to maintain the size. I've been getting my lips done for close to 10 years now, and now I feel like they're just to where I actually like them.
So let's talk about lips and all the different things you can do to make them look larger. I mean, I don't know if anybody has ever had a lip flip or a lip lift. Do you guys know the difference between the two? So we can talk about that.
Yeah, that's a great.
Let's talk about all the different things to make lips look bigger and juicier. So a lip lift. Well, let's start first talk about lip flip. Lip flip is very easy and simple. Say you don't want fillers, but you really wish you had more show of your upper lip, or say you felt like every time you smiled you could see too much of your gums or too much of your teeth. So by putting a little bit of Botox or Dysport right along the lip border.
And where do you inject?
I'm not giving away my secret.
Okay.
You're right. You inject somewhere over there on the upper lip. Okay.
Let's not do that.
But it could be injected on the upper lip. It could be injected on the lower lip for people want more show of both the upper and their lower, but without getting filler. A lip flip is a great alternative. So it's just a little bit of Botox on the top, a little bit of Botox on the bottom. And what that does is there's a sphincter around the mouth that pulls the mouth closed and purses the lips like this, and that, can you do that? And so what that does is putting a little toxin here, you can't do that pursing as much. And then it also allows the lip to roll outward and show more lip without getting filler. So it's a great alternative.
It's great. My girlfriend actually just came in.
Did we do that for you too?
No, we haven't done the lip flip, but we talked about it. We haven't done that yet, but I do have a girlfriend that came in and got it, and I'm just, every time I see her, I'm just like, oh my goodness, I can't get over how much I love the lip flip. One, it looks like she just got her lips done, so there's that. But two, her line of her lip, it just stays so nice and steady when she talks, when she laughs.
Wait, 1 second. I just want to cut you off for 5 seconds because I see somebody on here. Chelsea, I want to talk to you. I've been thinking about you so we can get together and kind of, some stuff.
Ooh, Chelsea.
So if you guys don't follow Billy Simone Jewelry, I see that she's on here right now.
Mask? I know where it's.
Yeah. So she makes awesome and cute stuff, and she also makes a chain for my mask and other people's masks too. It's super duper duper cute, and I get a ton of compliments on it. But she can also take your existing jewelry and say you lost, for instance, I have these diamond hoop earrings. That was the first present I bought myself when I finished medical school and got my first paycheck. And I lost one of them. We used to live in South Beach, and I remember exactly when I was. I was at the gas station.
Aww.
And I had one of those, like, I had something around my neck, and I pulled it off, and I felt my ear kind of tug. But I didn't pay attention to it until I went home, and I was like, my ear is missing.
Oh,
and so I went back to the gas station. Of course, it wasn't there.
Yeah.
Anyway, so I have one hoop earring.
For sure it was gone.
It was gone.
Yeah.
Reverse to the point. And I looked into replacing it and getting the other one by the same designer, but it was just like, it was stupid expensive, so I said forget it. Anyway, see this cute little...
Oh, I love it. It looks so great.
So these are called the paper clip chain, and they make them in 3 different sizes, and I think, and Chelsea, you may want to comment, I think this is your small size. This is your small chain, I believe. And what's great about it is that, you know, you can hook it up here and you can change it to whatever mask you have with this cute little clasp. And it's so great.
It is. It's really, really
and
great.
You do get a really cute diamond mask with it, but mine's dirty and being clean, but what about like this?
And listen, the masks
and then when you're done, you just kind of do that.
Yeah.
And then so you can keep doing...
It looks really chic.
So your mask never touches the ground. It's great. I love it. I love it. Love it.
Yes. Oh, what's this?
Megan Good, Angelina, Jessica Alba could be the ladies y'all wanting. What's that?
She Talk Megan Good. I love Megan Good, actually. And Angelina Jolie. And Jessica. I think Jessica Alba, you mean, Omar. Yes, the small link.
Okay, yeah, this was the small link. So this was really great. This was great.
Aww.
Okay. So I got
this.
Yes,
you guys see the Billy Simone jewelry. Just click on that and it'll take you to the page that has all of these great chains.
Yeah.
And tons of fun jewelry. Tons of fun jewelry.
So anyway, Chelsea, I need you to call me.
Yeah.
Okay.
Every time she comes in, she's dripping in gold. All the jewelry. I just love it so much. And so you guys should check her out for sure.
So yeah, and let's see, and I owe you pictures of my skin. Yes, you do.
Yes.
So,
blow a kiss.
So, and then what else? Oh,
Okay,
so you were telling me.
Yeah, my girlfriend got a lip flip, and it's phenomenal. So we were talking about lips. We were talking about ways to maintain your lips, and
add features the show. Add features, whatever. Let us know what that means. Let us know what add features means, Omar. Because
talking about lips, yes, we are.
We are talking about lips. Oh, you're a lip therapist. You're a massage therapist.
I think that's someone else.
No, it's Omar Roberts.
No. See,
talking about lips, Omar Roberts.
Oh yeah. But then you said massage therapist. That is a person.
Oh yeah, whatever.
Yeah.
Okay.
Welcome to the program.
My words are so big that they're blending on my screen. Anyway. So Omar, let us know what you're talking about.
I like lips. We do too.
We do too.
We love lips.
And this one loves them juicy too.
I love them juicy. On myself, on others.
Yeah.
I love me a juicy lip.
That's right.
So
she got a lip flip.
Yeah.
Did you say what happened with that? Did she like it?
I'm obsessed with it. I really, really love the lip flip. I don't have it.
Did I do the lip flip?
You did, yeah.
Okay.
Yeah. Just gonna not say your name. But yeah, so a lip flip is a great way to
Did she also get filler?
No, she hasn't yet. I'll tell you.
Yeah, I think I know it.
Okay.
And so we did the lip flip on her, and she loves how much
it looked like she got her lips done.
Oh, great.
Yeah, it looks really, really, really nice. So
it is a very good alternative for somebody who wants fuller lips but doesn't want the filler. If they're a little freakish about, not freakish, but like afraid to get the filler, a lip flip is great.
I guess it's a good starting point. I never thought about it.
And you can do it on the bottom one too if you just want overall just juicier lips. So there's the lip flip. Cons to that.
Can I say something else about a lip flip?
Yeah.
And this is just something that she told me. She was like, it was really great. You truly get your money's worth with this because it is a Botox and it lasts, a long time. Or if like say, a lot of people aren't working now, right? If you wanted to do something, a lip flip is a great.
It's not an expensive alternative.
Right. So that's what she said. Just, from a patient perspective, just to provide that for you guys. Okay, moving on.
So pros for lip flip is that it's just an injectable, it's quick, it doesn't cost that much, and it's not a permanent thing if you didn't like it.
Right.
Cons is that if you don't like it, it does last 3 months.
Yeah, you're kind of stuck with it.
You could get bruising in the area, so plan ahead. Don't come and tell me you got something to do that weekend because you might have a bruise.
Right.
And what other cons? That's kind of it, really.
It won't move.
Oh, you could have a trouble pursing your lips. So if you have a job that requires pursing of your lips, then it might not be the one for you. You just might want filler.
That's funny. Yeah.
Okay.
That is something that she told me. She was like, I didn't even think about it. But yeah, or like a straw, take a little bit of an adjustment, but you'll figure it out.
But you'll figure it out.
Yeah.
You don't want to purse around that anyway because you'll get these vertical lines. Anyway,
Right.
that's a whole different story. Okay, so that was a lip flip. It's with a toxin. Botox, Dysport typically are the main ones, and then it rolls your lip out and gives you an illusion that you have a lip aug without giving you all the filler.
Yep.
Okay. Second option, what is a lip lift?
A lip, oh,
Have you ever seen someone with a lip lift?
Yes, I have.
What do you think?
So I think a lot of it, for me, I see something when I see it, right? And obviously I work in the business, so I have a little bit of a trained eye. I think it looks a little unnatural.
So a lip lift is just what it's like you're lifting. So when the distance between the nose and the upper lip elongates as you age, it starts to look like really long. Some people don't like that look and want a permanent fix of that.
Yes.
And the permanent fix is when they cut around your nostrils, all here and around this one, and they cut a little almost like a mustache shape.
Yeah.
And then sew the lip back up to the nose.
It's a very interesting.
It's a very,
Yeah, it's a lot of people who get rhinoplasty have this procedure done because the distance from here to here usually gets longer when you have a rhino or your nose done. And so, a lot of people who get rhinoplasty have the procedure done, and sometimes I don't know. Sometimes I feel like you can see it.
Yeah, well, I think you have to have skin that doesn't scar. If you're one of those lucky people that when you cut yourself, you don't even see your scar anymore, okay, well, this is something to consider. If you're somebody that doesn't scar, it doesn't heal well after an incision, and you can see it, or your skin turns really light, then you're gonna see the suture line, and it's not going to look very good. And then you just have to do more, just have to understand that you're probably going to have to do more procedures afterwards to mask that scar, whether it's laser, microneedling, permanent tattoo, like medical grade permanent tattoo in the scar to blend it with your skin color. You're going to have to do a bunch of other things. Some people love it.
Right.
I think we just see probably the complications.
Right.
I think there's probably a lot of people out there who get it done and it looks great. And
you have to go to someone who does this procedure a lot, consistently.
And we don't do that in our office.
We don't.
So don't come to us.
Yeah. Don't call me.
Don't call us. But we can help mute your scar out if it looks bad.
Yes. Yeah, for sure. It just sometimes, I think it's something that you do look. I think the thing with plastic surgery, cosmetic procedures, non-surgical procedures is there is a fine line that you walk of when you do too much to the point where you look a little done. And if you the lip lift, I feel like sometimes looks a little done. I never thought I look at these procedures all the time. I'm like, oh, I could do that. I could do that. I could do that. Right. And I'm like, the only reason why I ever thought I could do that is because I did have my nose done. Right. And there is a bigger space, but I think
yeah, but it's not now that you have filler, because now it's the filler can mask that too.
And when you do it, it just sometimes gives this weird illusion.
You know what it reminds me of? You know when somebody has a cleft lip?
Yes.
And then they get that repaired?
Yes.
And then it kind of goes up in a weird way on one side. But just imagine on both sides it does the same thing.
Yes.
Doesn't it kind of?
That's a great analogy.
That's what it reminds me of. But it could look good. I mean,
it might be the thing for you.
We're not going to do any procedure. So that was lip flip.
Yeah.
Now that was lip lift that we just talked about. There's filler, which you guys all know about, dermal fillers in the lips. It can last. Can last up to say 15 months depending on your filler. Some Juvederm products say they could last closer to 18 months, 2 years, but then they do come with certain risks of nodules and things like that, but they could be used. And then what else is there?
There's fat transfer. We do a lot of that.
So tell us about that. What does that mean?
So say a patient calls and says, I'm really interested in a fat transfer to my face. We do these a lot.
Or just they want their lips, like a permanent fill for their lips.
Okay, they want a permanent fill, something that's natural. People probably think, that doesn't exist, but it does. And through your own fat. And what you will do
And where do they get the fat from?
So typically it's taken from the abdomen. Say you've had a tummy tuck or whatever the case may be, and you may not have fat on your abdomen. Sometimes we explore the knees or the thighs, and we'll take some fat from there. We never take such a substantial amount that you're gonna notice an indentation or any sort of unevenness from the place where we have harvested the fat. So we take the fat, then we assess the face. If in this case we're looking at the lips, we'll cleanse the fat so that we're only putting the best, most usable fat into your lips, and then we inject it into your lips, and it's permanent. That's what's really, really nice about a fat transfer to your lips, or we can do it on many other places in the face. Pretty much anywhere where you would put filler, right? Or no? Could you do like jawline fat?
Yeah.
Or okay.
But people, unless you have a defect. So fat can be moved anywhere around the body from its original source to a new place. Or original, let's say home. So wherever it's like normally, like say it's in your abdomen and you want larger boobs, then it can be moved to the boobs, or it can be moved to the butt, or moved to the face, or the hands. Those are the most common places that fat gets moved to. But if somebody has like, say they had an accident, they have a really weird defect on their arm, it can be moved there too. So it can be moved anywhere. But just understand, once you take it from its happy home and you move it to a new place, not all the existing area and fat is welcoming that new fat. So some of that new fat will not survive the transfer.
Correct.
It's about 50%. So typically it gets over-injected to get you to where you want to be as an end result. So it is a surgical thing. It's a awake surgical procedure that Dr. Justin does.
And we do it, like Dr. Sarah said, to many areas. So whether we transfer to the butt, the breast, the face, the hands, what we always tell patients, we consistently tell patients, is you can't get married to the size. But particularly when it comes to the face, we always say, you're gonna leave and you're gonna think, oh my gosh, my face looks crazy, because we will overfill for that exact reason. So we always have to manage the patient's expectations and let them know that, listen, when we put this fat in your lips are going to be really, really swollen for 1 to 2 weeks. If you have, events, not that people are going places, but maybe you're doing a small
I
gathering
think in the
or
face,
something.
I would have to disagree. I'd say
like 2 to 4 weeks.
Oh, for sure, it's a month. It's like a full month. You're like a marshmallow, okay? And then it's like eventually you're like, oh, okay, oh wow, now you look good.
Right. Yeah, for a month you're pretty much like.
For a week you're hiding.
Yeah.
Okay. For the next week you're like,
for a week you don't know anyone.
Maybe I can go grocery shopping now.
Right.
And then the next 2 weeks it kind of settles down, and then you're good. But definitely 2 weeks you're hiding, and then or near hiding.
Yeah.
I mean, with the mask now with COVID, it probably is a little bit different, but yeah, you're swollen. You're swollen. You're like, what did I just do?
Right.
For the first week.
Right. We should honestly have some sort of expectations versus reality type thing.
Like lip og ones.
Yes.
Like it's like, oh my god, my lips are so big. And then it's like, wait a second, I liked it.
Right.
and then wait.
And then you're coming back for more.
And you're like, I need more filler.
Yeah. Exactly. So that is the one thing that you need to be prepared for. Y'all make me want a
nose. Oh, y'all want me to make
a nose
D-filler? And why nose is a little wide?
Every time I kiss a woman.
It's like my... Omar, are you drunk? I don't know. I don't understand what you're saying.
Omar.
Omar, we don't understand what you're saying. You're saying all this weird stuff. Okay. A little wide.
Do we make you want to get your nose done? Your lips done?
I don't know if Omar wants his nose done. He just wants a big nose to kiss. I don't know what he's talking about. What is he talking about?
Omar.
Can you make sense of that? Yeah. I don't understand what you're saying.
Hi,
Maui 928. How you doing?
What is the price range to? Now we gotta look down here. To insert on the front lens. Hello.
What is that?
I have a webinar.
Okay. Dr. Justin just rolled in.
Dr.
Do you want to
Justin
say
in the
anything
house.
yet? Tyler, you want to come say hi?
Hi.
Okay.
Okay, so what's the price range to insert on the frown lines? So, Cindy, are you looking for filler on the frown lines?
Oh, these frown
lines,
Oh,
or maybe these ones.
Are you talking about the 11s, or are you talking about this? This is more like laugh
Let us
lines.
know and we'll answer that question.
Right. So if you're talking about like these two 11s from people frowning, because that's probably where it is, then that would be a little bit of toxin here. It's typically around 20 units of Botox, give or take. And that will run you a little bit about $260, I think.
Yes.
$260, under $300. Hello, Maui928. Happy holidays.
Love that. One thing we should talk about, I actually did this today. This is an actual present for my girlfriend. Hopefully she's not watching. Not my girlfriend, but like a girl that's a friend. And her boyfriend...
Ashley's like, I'm free.
Yeah. Her boyfriend was like, I don't know what to get her for Christmas. And he put some things together, but he still wanted to get her something. And so she had been talking about...
ruin her Christmas present?
I might.
You're ruining her Christmas present.
She really wanted a peel, a chemical peel. And I'm like, well, obviously you got to come see Dr. Sarah. And so I was like, you know what? Why don't you just call me and give me your credit card? And he did. And he entrusted me to put this together for her. And she has a gift certificate, which we beautifully offer at Ideal Face and Body. So we can fill this out.
But you can't see it like that.
We can complete this for your loved one and put it together in this packaging. How cute does this look?
Very cute. Love it.
So she got a peel, which is on her gift card, and the pumpkin mask.
And then she got the cleanser and toner.
Cleanser and filler in a bottle.
I love that cleanser.
I do too.
It smells citrusy and it's so great to have in your shower. And it's so big and you can
It lasts forever. It really does. It lasts a really long time.
And then you wash your face with that and then you use just regular bar soap for the rest of your body.
Yeah.
But yeah.
So I put
That's
this
very
together.
cute.
Yeah,
Good
it's
job.
really cute.
Yeah.
So you guys can give us a call at the office if you don't know what to get your significant others. Or ladies, listen, if you know what you want, just do yourself a favor and tell your man. And then have your man call
I thought
us.
you were going to say just buy it yourself.
Right, no. No.
That's how I do it.
Yeah.
And then I wrap it and
Right,
stick it under the tree.
Yeah. Actually, that is a very good move.
I'd rather just get what I want to get.
Exactly.
You know?
So ladies, have your guys call us and trust us. We will not do you wrong. We'll put a cute, we can even put your surgery on a gift card. We'll just write it on there for you so that he feels good about having it.
And we do have, and you didn't put it on here, I thought you were going to pin our special.
I will.
There's a... So we
We
have a special for this month, 20% off all our skincare, isn't it?
Yes.
Yeah, 20% off all of our skincare for the month of December. So
We'll go to that right now.
go ahead and do that. So, okay, wait, did we go over everything with the lips? Oh, and then there's lip implant.
Oh.
I don't know about that. That's
Yeah.
really gone out of favor. It is silicone, typically implant. It goes in, and it doesn't look good. It looks very unnatural, and people used to do that. They used to also inject silicone. People don't do that anymore either. I think that's kind of really it. As far as the lips, I think I went over everything. Right.
Yeah, we did. We pretty much covered it.
So if you guys have any other questions about the lips,
Okay, just pin this.
Oh, December special. There it is.
Yeah.
But I thought Gracie did a different new one instead of that.
Well, we have one for this live.
Oh, we do.
You want me to do that? It's the same thing.
It's the same. No, just do December special.
Okay. Pin comment.
We'll know if it came through. Okay, so you meant by the nose. You meant up here by the nose, or like?
Sorry, I meant the lines by the nose. Probably here. The nasolabial folds.
I don't know, because you have bunny lines too. There's
Right.
so many. Let me just go over all the places where you can get Botox. Okay, there's the forehead, which is for the two big muscles right here, frontalis muscles, so you get that injected. And that prevents the horizontal lines across the forehead, right? There is around the eye. You can inject the bicularis oculi right here for crow's feet. Also, a little drop down here. Usually physician level does that. But a drop down here for the crepiness under the eye.
And why is that?
What do you mean?
Physician level.
Typically because...
This is a good thing to pay attention to.
You know, if you inject too deep in that area, you can cause the eye not to close. And it can be a big problem. And so you really only want to get the very thin muscle that's on top. And you can also paralyze them like your smile.
Could you imagine?
So it's like this. on one side, you'd be like that.
If you need to point to my face.
Okay, I'll poke in the eye. Okay, so we have orbicularis or oculi here, and then can you scrunch your nose? So these are considered the bunny line. So some people want across this nasalis muscle. Some people want this injected too. But you want to get a little closer. Okay, so let's do Ashleigh like this. Oh. So then there's, nasalis, which is right here on both sides, gets that injected. The lip flip is injecting of the orbicularis oris right here, and maybe down here as well. There's a muscle that pulls the corner of the lip down, so some people get it injected right here. It's called the DAO. For people who clench a lot, you've got your masseter muscle right here.
We do this a lot.
And so inject into the masseter. Down here at the base of the nose, a little injection can cause the nose to raise up or upturn. No, you don't have to show me. Let's see what else. I said frontalis. Oh, and then for the 11s right here in this area is the glabella. So you have your procerus muscle here and the two corrugators. So this whole complex in this area gets injected to prevent the 11s or like the bitchy face.
Can't do that.
No. And then also...
Thank goodness.
And then people who have dimpling of the chin love to get the chin, the muscle right here injected just because it smooths out the chin. And then for these platysmal bands, she doesn't have any, but you can definitely see them on me right here. So you get injected in here. It's called a Nefertiti lift.
Ooh.
And that can help smooth the neck out. So those are the most common. Did I miss anywhere? That's the most common place. Some people get in their hair if they feel like they sweat a lot. That's not as common.
You can do underarms, hands,
underarms. But those are probably the most common places on the face where people get toxin injected.
Yep, for sure.
That was a pretty much good summary.
Yeah. So that's what we can do from a. I always like to say I like to be filled and frozen. So that's pretty much where you can get the frozen part.
I thought you were going to say you like to be wined and dined.
Yeah.
You accept this final rose?
Yes. I do too.
I don't know if anyone saw The Bachelorette yesterday. I'm such a sucker for that, but
I did not.
You did not?
What's going on with that?
Well, you heard about the season.
Kind
So
of.
this season there was this girl, Claire, on there, and she fell in love with this guy, Dale, immediately, and kind of ditched all the other guys.
Wow.
So to make them happy, they brought in Tasha. Tasha is from a previous season.
Okay.
And she's so cute.
Okay.
And all the guys just fell.
Really?
Yeah. She walked in, they're all like, you can see the jaws just like.
How many episodes or like shows in?
So it's the final 2. I think there's only 2 shows left, and it's next.
But
next
I'm saying
week's the
like
finale.
how many
shows with Claire?
I
mean, I don't know. It wasn't that many.
Like 2?
She saw Dale and was like, that's it.
No.
Yeah, as soon as he came out of limo, she's like,
no.
I just met my husband.
Wow.
And
I
that
gotta
was
see this Dale guy.
Yeah,
Oh, wait,
he's cute.
that was me.
That's
No?
it.
Oh. Missing drink.
Yeah, Dale's super cute. Yours is back there.
Oh.
Dale's super cute.
Aww.
Yeah.
Botox is the cure for the,
Ugly minor moments. Yes, for sure.
we just freeze it all away.
But you want to have a little bit of movement just so you don't look like, like Cher was probably too Botoxed.
Yeah.
You
leave Cher out of this.
Ashleigh's Halloween costume for the last 7 years.
I met the guy this past weekend who is responsible or was responsible for Cher's hair.
Oh, really?
Yes.
But they were all wigs.
Not in the early days.
Oh, really? You mean that long, thin hair?
Yes, he permed her.
Permed?
Yes. You have to think about the time period.
Wait, permed like straightened permed or permed like curly permed?
No, look at this. That's him. There's Cher. Wow, what a great picture.
You want to show them that picture?
Yeah.
So this is the guy she's talking about, and then there's Cher right there.
Yep, and Dolly Parton.
Oh, yeah? Which
That's
one's
Dolly Parton.
Where? Oh!
Yeah, and then this was Charlie's Angels. Kate Jackson.
Oh, yeah.
There you go.
Dolly Parton, Kate Jackson is right there.
Listen, you never know who you run into at Whole Foods here in LA.
And you ran into this guy and he gave you a picture of that?
I'm like, I gotta see this. Yeah.
But why has he mentioned that at Whole Foods?
Yeah, you just in line, checking out, commented on my pretty eyes. And, and I said, thank you.
And he's like, look at this picture from 50 years ago.
Yeah. Yep. Yeah, just
interesting.
Another day in LA.
So if you guys have any last minute questions for us, we are here to answer anything last minute.
There's always more Botox clients, okay? People are always wanting Botox. Yeah. Especially around this time of year. So you guys should call us. We have banking specials for $1,000 for you can bank your Botox with us.
And that just means you prepay for the vial of 100 units and you get it at a discount, which is $10 a unit. And so you pay $1,000 up front and then we just tick down the amount that you use. If you're going to be coming regularly, then that's the way to go. Otherwise, it's $13 a unit at this point.
Yep.
But with inflation, we may see. No.
Yeah.
And let's see what else. Anything else that's new and exciting?
I mean, it's a great time at Ideal Face and Body and YovinoMD Beauty. I mean, it's just been a busy time of year for us. If you guys are looking for a new practitioner for all your aesthetic needs, I would for sure recommend.
I heard a lot of places were going under too. A lot of places.
Oh yeah.
You know, and so their clients don't know where to go. I have to call one of our patients who told me that somebody he knows went under.
Wow.
So maybe we'll get all her places people too.
Yeah, we're very fortunate to be,
we're doing well.
Having two physicians that do amazing work,
and maybe
both
third,
of them.
So stay tuned.
Yeah, stay tuned. Do amazing work. So we're very, very lucky.
I think that's kind of, I don't know if there's really anything else to add.
No.
Listen, people DM me all the time with questions and with comments. Feel free to do that if you have any quick questions.
Yeah.
Or Ashleigh, if you have any surgical questions, you can ask her. If you have any, questions about what treatment might work for you, if you've got, if you need skin resurfacing or you don't like the texture of your skin and you want to know which one of our products would be the best ones to maybe go after, don't hesitate to DM me. I just want you to know that our products are dermatologically tested. They are clinically proven to give you results. They are medical grade skincare, which means it's going to be superior than anything you can buy in the store, just hands down. It has ingredients. It's a much higher and more effective rate and much better carrier molecules to bring the ingredients deeper into the skin. So you will see results. It's proven to give you results. I mean, look how great my skin looks.
Amazing.
You will love it, hands down. I haven't had a single complaint. Free of parabens, formaldehyde, gluten, sulfates. So you'll love it.
Plant-derived, cruelty-free for all you vegans out there.
Yep.
We got you.
She's a vegan.
We got you.
So it's great. And we have, if you want to sample the products, we do have little travel kits that Ashleigh forgot to bring to show you guys, but maybe we'll show you next time.
Ashleigh forgot.
So we do have travel kits that are a little bit less if you just want to sample the products to begin with, that you can purchase. Online as well.
There you go.
So
they're so cute.
They're very cute. And our full size, stuff as well.
Great gifts, guys.
So any questions, please let us know, and we are here to answer your questions. And I think that's
that's it. We'll see you guys next Wednesday.
Yeah.
Alrighty.
Okay.
Be safe, everyone. Bye.
Thank you.